Am I eligible for the MenB vaccine? MenB stands for meningococcal B, a bacteria that can cause meningitis, which is a serious infection of the lining of the brain and can lead to serious and life-threatening complications like septicemia, which is blood poisoning. And the recent outbreak in Kent just reminds us how serious that this infection can be and that vaccination is key. So understandably, we've had lots of inquiries at our GP practice and I'm sure across other surgeries in the UK about the MenB vaccine. With regards to eligibility for the MenB vaccine, currently it was introduced to the Chartered Immunisation Schedule in 2015. So currently babies aged 8 weeks, 12 weeks and 1 year are eligible for the vaccine, and there is a catch-up programme up until the age of 2 at your GP surgery if your baby misses a dose. However, for older children and for adults, unfortunately, they would not be eligible for the catch-up programme, and they would have to access the vaccination privately, either through a pharmacist or through a pharmacy or through a private clinic. And what we hear is that the costs are very variable for these private vaccines, and it can ranging anywhere from £115 all the way up to £260 in some cases. And even privately, you may find that it is out of stock. And if that's the case, you can always give your details to that provider and ask them to give you a call back once they've had a delivery of the vaccine, to see if you can access it in that way. Now, in the meantime, I would just say trust your instincts. If you feel generally unwell and you have headaches, neck pain or stiffness, unexplained rashes, light sensitivity, something feels off, something doesn't feel quite right, please seek medical help. Don't wait. This is a serious infection and it can spread rapidly. And finally, I want to say one other thing is that there are other strains of meningitis. So while MenB accounts for 80% of cases, with regards to the other strains, MenACWY, you do receive this is part of the immunization schedule also, and children tend to receive that vaccine in years 9 to 11 at school. So if your child has missed a dose, they do qualify for a catch-up at the GP surgery up until the age of 25. So please contact your GP about that if you have any questions. And if you're not sure if you've been vaccinated at all, just speak to your GP and they will be able to help you. So I hope that helps, and if you have any further questions, feel free to DM or speak to your GP.